I think it
captured.
worked for her live.
Yeah. All right. I think we are on.
Yeah.
All right. Hi, Shafeeqah.
Hello.
Anyway, hi, audience of Facebook. My name is Siwei. I'm representing Aphasia SG, and today we are very, very lucky to have Shafeeqah here with us to share with us her experience. So, Shafeeqah, can you share a little bit something about yourself to our audience here today?
Okay, so my name is Shafeeqah. I currently work as a communications executive. So what I do is I handle the comms part and the publicity and the social media and just media relations and all. And I've been a volunteer with Chit Chat Cafe since last year.
Oh, yes, that's how we know each other.
Yeah.
Yeah. And so today you're going to share a little bit with us about your stroke journey. Being so young, I think no one will ever imagine that you'll be here sharing with us today. So yeah, so you had your stroke in last year, right?
Yeah, last year. So last year, when I was just 26, now I'm 27, I had a stroke, and it affected my, oh my gosh, I forgot, left brain, right?
Yeah,
Yes.
that's right. You got it.
The life on Facebook kind of stumped me.
I know, right?
I was like, what, left or right? Okay, so yeah, my left brain. So it affected my speech center and mostly just my speech center. That means the stroke just only affected my ability to speak and read numbers and writing as well. But it didn't affect me in like mobility wise. So thankfully, I was lucky enough to only like the stroke only affected me that way. It was just the aphasia and nothing else other than like my eyesight is not the best. I mean, it's fine now, but
Okay.
I had double vision, and my balance was off, but it's fine now.
Oh, that's good. Yeah, sometimes after stroke they do affect a vision a bit, but it does affect quite a large part of your language ability, given that you're in communication sector, right? So, having stroke such a young age, how did that make you feel? Like I think no one at 26-year-old would imagine themselves being at your position. So
Yeah, I would never have ever imagined that in my life, and also like at a young age and in my 20s that I would have a stroke. Like I was aware that people at a young age can get stroke, but I would never ever have imagined that it would happen to me, but it did. It was so funny as well after, not funny, haha, but like a fun anecdote. So after all my friends and family found out, and one of my friends was like, "Oh no, you pulled an Amelia Clark on us." I'm like, "Oh yeah."
Oh yeah.
I was like, I didn't mean to, but yeah, it happened. So yeah, so I think for me, when it happened, I went through like an emotional process. I think firstly it was just disbelief, and then confusion, and then deep sorrow, and then finally rage. Also, like maybe the rage is intermingled with the sadness. Sometimes one day can one day it's like one emotion would probably be more than the other. But it was like really a roller coaster emotion, and I don't really have the words to say it, but it was really quite devastating to my sense of self. So how I viewed myself, how I perceived myself, and how I thought people would perceive me was really it was really quite like confusing. And also I think that's when the rage comes from as well, because like I don't know who am I, and I'm not sure people will see the way that I was anymore, or if people will view me differently. Yeah, so yeah.
Right. So it's really unimaginable with so many things happening. Yeah, and confusion and the range. I'm sure even up to today, sometimes they would still have that question like, why me? Why now? You know, that kind. Yeah.
Yeah.
So with such roller coaster ride and so on, like who were your pillar of support? Like, yeah, who plays the biggest part in your recovery process?
Thankfully, I'm so like I'm so grateful that I have all this support system that I can really tap on, and I didn't even really have to ask for their help or like ask for their support, and they just came through when they saw me, like when they saw me in the hospital bed and all, or during my recovery. And it's mostly, I have so many people to thank, like my fiance firstly, and then my family, my sister, and my mom, and all my family and friends. It's my cousins, everyone just like made me feel loved. And also, and more importantly, I think I could see in their eyes, like they were sad for me to see me that way, but they didn't treat me any differently. Like they waited for me when I couldn't like speak or was trying to struggle to speak. They were still patient with me. Of course, with this like sympathy in their eyes as well. But I think the fact that my relationships with them didn't really change, like we can still like joke together, laugh together. It was like, it gave me some like sense of normalcy, and feel like, oh, okay, actually it's not, I feel like it's okay, you know. It just made me feel like I'm okay.
I really like what you say, like, you know, they still treat you as who you are. Although you may be slightly different and still recovering, but they still treat you as who you are, no matter what. Yeah, I think that's really important to give you that sense of normalcy. Yeah. And I remember you were sharing with me some of these pictures. Yeah.
I mean, you can see that I didn't have enough like table space in my really small hospital.
Small confined space.
So the flowers were overflowing, and that's not all the flowers I had. My mom really took back some to the house because it was really like too much. I was like, yeah. so it was really nice. And then and also then my friends came down to visit me, and they know I was going to be bored in the hospital, so they brought me graphic novels. And I think they also didn't know, I mean, I don't know what, I think they knew that I couldn't really speak or write or read that well, even though they haven't met me. But I think from my sister, probably they talked to my sister, trying to come down to the hospital. And before meeting me at the hospital, they went to the library to borrow a lot of books, and also some of their own graphic novels for me to like read in the hospital. But the first one you see that is like not really PG, so I so I was like, and I didn't even know. So I was like, and there were nurses walking behind me, and I was like, oh, no, not this one.
Oh no.
Gonna try to find another one that is more family friendly. Yeah, it's so nice though.
Yeah, it was so nice that they actually understand like what you may go through and find ways for you to continue reading, knowing that you're someone who likes to read. Yeah.
Yeah, it was really, really nice. And they also gave me a stuffed animal to like keep me company at night.
Yeah. So this was a photo you shared with me as
Yeah.
well. Yeah. Your first time out of the ward.
Yeah. So because like I couldn't leave the ward even though I could move and I didn't have trouble walking on my own. But because I was like strapped to like a heart device thing that you're trying to track my heart thing.
Right.
So I couldn't leave the ward. If not, the device won't work outside the ward. So after that, sorry, I'm just getting distracted by the messages coming in. I should have turned that off. Yeah.
Okay.
So.
Yeah, so it was really nice to get some fresh air.
Yeah, it was really nice.
Yeah, after so long cooped in a small space.
Yeah, it was not even just I was cooped in a small space, and I was sharing a bed with a lot of other patients, and it was in the stroke unit. So and everyone around me is an older person. So
yeah,
my
definitely.
younger presence was really kind of felt by other patients. I mean, patient visitors. They would like look at me like strangely, like why is she in here? She doesn't look like sad. She doesn't look sad. I mean, like she doesn't look sick.
Can't really tell for sure.
Yeah, so I think people were like, why is she in the stroke unit and all? And I just didn't like being watched. I think
I'm sure.
didn't.
Because you really stood out, right? You really stood out in that crowd. Yeah. And to add on a little bit on your roller coaster, and you had to celebrate Raya in the hospital.
Yeah. So I had to celebrate Raya in the hospital. I was so sad that I couldn't go home and like celebrate with my family normally and like wear my baju raya clothes. Like I it was like I already ordered it and I was like waiting for its arrival and it hasn't arrived. And it arrived when I was in the hospital. So I was really sad, and my family knew it was I would probably have to spend Raya there. So my cousin so kindly and so creatively as well, like decorated my small space with like cut out fairy lights, like latte and stickers and Raya vibes, and it really lifted up my mood. And just seeing those colors, because so much of like hospital decor is just drab and gray and beige and so lifeless. But just seeing that, it just lifted up my mood.
Yeah.
And then
And it's really creative.
Yeah, I mean, she's an amazing artist, and it's not even her best work. Like, she honestly is like so good. And then also, I was also surprised that Kutek White also like had this special menu, lontong. I was like, oh, I still can eat like Raya food, so I was really happy about that.
That is good. That's great. Yeah. So we do have a question from PLK panelists. So they ask, how did you regain your self-identity? How long did the whole emotional roller coaster last?
I don't think I'm off the roller coaster now, but I feel maybe it's I think it's calming down. I think I'm still trying to figure out who am I post-stroke. So I'm not sure about that. So I don't know how to answer that because I'm not sure if I have regained it. But for me, for my sense my sense of self, like I felt it was so devastating because like my main identity for the longest time was like I was like, okay, I'm only good at language because I'm not good at math, I'm not good at science. um, Language is the only thing I can do. So I kind of really um, really like took that as like my main identity. So but to have it like wiped away like instantly, it was really confusing. So then I tried to bake more. Oh, so I
Oh
do
yeah.
bake. I do bake even before stroke. I think I baked with I baked when I entered uni. I think like more regularly.
Mm.
So then I was like, okay, I need to find other identities that I feel that are already in me, but I think maybe I need to just push it out more. And then I remember thinking also like, um, this main identity, it is not only my sole identity. Like I have many identities. I'm I'm a baker. I'm a feminist. Um, I'm a daughter and I'm a sister, and so there's so much more identities for me to focus on other than the one the one that I lost. So I was trying to just shift my focus there.
So sometimes it's just really hard. At plus, it's only been a year, and there are still so many searching to what's in you and to fit in all the
Yeah.
roles. Yeah,
Mm-hmm.
and yeah, I think the emotional roller coaster would not really go away,
Yeah.
right? Yeah, because as we all know that 93% of persons with aphasia suffer from psychological distress and depression. And there are even studies to have shown that stroke survivors who are 50 years or younger are nearly 3 times more likely to suffer from anxiety and depression than older survivors. So yeah, this does speak a little bit about the whole emotional roller coaster thing. So what are your thoughts about this?
Yeah. I think I only can speak about my own experience,
Mm,
about my own anxiety, and I don't think I can speak about all young stroke survivors having anxiety. But I think I can relate, and like it feels real to me because it was it was a case for me. Um, and yeah, so I think it was mostly like I think the anxiety really hit me and I was depressed. Um, Probably because at a young age you're still like figuring out who you are,
yeah.
and then after the stroke it feels like you already had a life plan and then it got derailed
Mm,
from like a health event that you would never have imagined, and you would think like, oh, it's only for old people. And um and and it's really hard for you to kind of like find yourself when you're trying to find your, like you are already so confused, but then add to the confusion of like the stroke and uh, obliterating your whole sense of itself. And I'm like, so really it's a lot. It's a lot.
yeah. I think it's really a lot to take in, like even up to today, you are still struggling with those emotions and you do get, I think it can be quite traumatizing.
Yeah.
Yeah, and do you think are you getting any help or assistance or
Oh
that
yeah,
that
just before I just forget, because I just kind of like it just popped into my mind also. Like I think also because um like younger stroke survivors would experience more anxiety as well, because you lose so much. You feel like you're losing also the youthful experience. Like I thought like, oh, I cannot run as fast as my other peers, or I can't like stay out at night late at night, because the fatigue post-stroke was really bad. I think I was sleeping maybe 15 hours a day. So I feel like I don't have that window of time to like socialize and really, and I just felt like I was losing out a lot. And so, and also like your routines seems like an old person routine. I'm not trying to say like it's ageism or say nothing wrong with that, but like when I have to take my medicines daily, like I would never have imagined like at 27 I have lifelong medicines that I have to take daily. So it's a constant reminder that it's my life is different. So and have to be more careful about what I do or what I eat. So it's also that part, I think, just feeling like you don't know yourself, and also feeling like you are losing a lot of experiences, like what is it called, the abbreviation.
YOLO, is it?
No, not YOLO, but well, I cannot remember, but is it like missing FOMO? Yeah.
FOMO, yeah. Oh,
yeah.
well,
so it's
sorry,
like,
I'm at the different era. FOMO, okay.
Yeah, so it's like really, I think it's like an intense FOMO.
Yeah, I mean,
After
you
that
see
stroke.
other people of your age doing things that, and you look at them and you really can't do it. You think twice when you can do it, at least. Because being young, well, your recovery is better, but it doesn't show what's really happening inside. Yeah. So we have another question from Jeannie. She asks, what self-care tips can you share to manage your wellness or anxiety? So
I think for me, the one that has worked for me, and it's still really a work in progress, like honestly, trust me when I say that, because it doesn't always work for me like 100%, but practicing compassion for yourself is really good. So like whenever like I make a mistake in my speech, like maybe I pronounce something wrongly, or I didn't pronounce it right, or I said the wrong word, and I try to like brush it off like it was nothing, and people would not usually notice it, and people would just think like, oh, it happens to everyone. But I would feel it more intensely, and I feel like it's not just a mistake. It feels like so much more than a mistake. And then I would start to criticize myself, and I'm like, why am I like this? And it will always like lead to the stroke, like, oh yeah, it's I'm different. Or but it I think being aware that you are a little bit different, even though you've not different. I'm not saying like different in a bad way, but different in a way that people are always constantly evolving. I think when I catch myself making that mistake, and I start criticizing myself, and then I try to like activate the compassion side, I'm like, okay, it's fine. Making a mistake is fine, and you are like you have aphasia and you need to cut yourself some slack, and you need to be kind to yourself, and
More forgiving.
it's yeah, exactly. And being forgiving and being accepting about living with aphasia, that it will always come up from time to time, and in places or like in times that you really really least expect it, or times that are really inconvenient. But you just, I think it's just, I just have to accept and forgive, and it's still a work in progress. But I think it's getting better. Yeah, because as long as I can understand that it's not really me, I'm not really making that grave mistake, but it's fine. Like, I'm also human, and mhm.
Yeah, like you are also human. That's really important. And I felt like, I think your emotional maturity has just gone like a lot more. Having go through such trauma with so many emotions in you. How do you think? We have a question here. How do you think, like, um, to consolidate and all these emotions that you're facing day in, day out? Do you get assistance, or do you get someone to talk to?
I do. So for me, I've been seeing a psychologist since I was in the hospital. So I've been seeing the same psychologist. So she has seen my progress. The way it happened as well is because the nurses saw me crying all the time in the hospital, and then they told the doctor, and the doctor was like, the nurses told me that you've been crying a lot. Would you want to seek help? And we can arrange a psychologist to meet you. I was like, yes. I was like, yes, please. I was like, can you get her like stat, because I need to unload now. And so other than my psychologist, and it really helped me, like, I mean, she's the one who taught me about, oh, my green skin is falling.
It's okay.
And then she's the one who taught me about self-compassion, being kind to myself, and also like my support system. Like, I really really can depend on them. I can call my
That's
fiance
great.
anytime, and I will call him when I'm having my anxiety, and he knows how to calm me down, and he knows exactly to like ground me.
Wow, that's really good.
Yeah, I think the recent one is like, I called him, and then he's like, I was on a spiel or a rant of obsessive thoughts and all, and then he just grounded me and said like, oh, I have a balloon with me right now. Do you want to guess what color it is? And then it distracted me, and then I had to guess the colors, and then it reminded me that I'm safe in my house, and I'm not under attack, and I'm okay.
Oh, just it's so important to have someone to guide you through, and also to have your support system so readily available, like just as simple as a distraction as such.
Yeah.
To remind you where you are. So we actually have a friend here, a question here, okay, from our Facebook audience. So from Zara, I wanted to ask, how do you suggest friends help to support those who have or had aphasia?
How to support friends who have had aphasia? I think just being there with them and feeling like they're still a part of the group, um, and not treating them differently. I think for me, my main anxiety about social interaction is I was saying like, oh, I can't make jokes anymore. And people will feel like I'm not Shafeeqah anymore. Like, what's the point of even socializing when the bulk of socializing is talking, and now I can't do that. So I think try to find ways that you don't have to talk so much. And I remember my friends visiting me after the hospital, and they came in a group, and then we played board games, and I was feeling really quite anxious about it, because I was like, okay, I don't know how I will socialize. Would it be any different? But it didn't feel different. I mean, it felt a little bit different, but not overtly. And it still felt like a familiar embrace of friends, and it was nice. And I think maybe because my aphasia was not too severe and it didn't affect my understanding, so people could still speak to me normal, and I could still understand, and I could still like read, like on board games, and so it's fine. But when reading aloud, that was the problem for me.
That was the daunting part, reading out loud.
Yeah, but reading silently in my head, I understood everything, so it's fine.
So since you're talking about this, right? So we have a question here from Munira. So back then, when you have difficulty talking and expressing yourself, what do you do to convey your message? Do you need to write out or draw or this? Yeah.
Honestly, writing was easier for me. I think I felt like it was easier for me, but I think at that point I was so blind to my mistakes. So when I read it back, I would think like, oh, no, there was no problems, there's no errors, but I kept some of like all the writings that I have on my phone, and I realized, oh, actually it's filled with errors. But at that point, I thought, when I read it back to myself, it's fine.
It's fine, right?
So I felt like writing is better, but I did think people could still understand what I was trying to get at by writing more, mostly. So yeah.
Right. And we have another question from Athena. Wow, how did you find such strength to improve so drastically?
I don't know.
It adds on everything, right?
Yeah, I don't know. I think possibly, I'm not sure if it's my strength or my willpower, or it's just because I'm younger. So my chances of recovery at a faster rate is like much better. You would know because you're a physician. So about some brain plasticity and like my pre-morbid status, like my SD and all my doctors would tell me, oh yeah, because I was also confused, because like, why is my progress so fast when you said that it affected like 1/3 of my left brain. So I was also confused because I was just trying to understand. But I think for me, I think it's usually also the support system that I had. I was, oh, you can see everything's happening.
Some of your pictures, but it's okay. Don't worry about it.
So yeah, sorry.
So you're talking about being young, and you were also confused.
Yeah.
Why you recover so fast, and you're saying that because your pre-morbid status, you have been reading and writing that much. Yeah. Probably. Yeah, I'm sure that those are some of the factors that helped you as well. Yeah. So having said that, you were saying like everything actually happens inside. So I just want to share this slide. Like, aphasia is an invisible disability, and I don't know how much to stress on this, because the first time Shafeeqah joined us in our chit chat cafe, the time we had a physical cafe, and we ourselves were confused whether Shafeeqah was a person with aphasia or was she a volunteer. And did you know that it was because of you, we actually changed our processes to make sure that our name tag could identify who is a person with aphasia and who are volunteers, because we really did mix up. And we actually improve and improvise on these processes. And you reminded us that really aphasia, it really doesn't matter of age. And at the same time, it is so invisible that sometimes people will get mixed up. Yeah.
Yeah.
And um, on top of that, also being back to this topic, being aphasia is such an invisible disability. How did you cope when you have to go back to work?
Go back to work.
Mm.
I went back to work quite fast actually. After 1 month, and then I went back to work, and
It was really fast.
it was really fast, and I was not ready. I was not ready at all to go back to work, but I was like, okay, I'm just gonna try. If I don't try, then I won't know if I can't do it. So I'll
Mm.
just try it first. Um, but when I went back to work, but I have a really good workplace that really supported me, and saw like they were with me at the hospital, and then visited me afterwards as well to show support. And then the support didn't really end there. It still continues until today. um, and they were really supportive. So I was working lesser hours, but still on full-time pay. Um, and they were like, okay, just go home whenever you feel tired. Um, and it was nice, um, but I also remember that it was really hard for me to go back to work. Um, I think one full day, or like not full day, but half day of working.
Mm.
The only thing that I could manage was to write one short email, and it was so hard, and I'm sure it was still filled with errors, because I was just reading and reading and reading every single thing, because I couldn't trust myself. I was like, I know my aphasia is probably somewhere there, but I also know that I can't see my own mistakes.
Mm.
So there's this thing like I'm distrusting myself, and because I know it's there, but I can't see it. Uh, so it's really hard. So then sending the send button in hitting the send button is much more difficult, because it's like I know there's errors, but I can't see it, but I'm just gonna send it. And also the fatigue thing that I was telling you about, like I
Yeah.
was like winded after. I just the mental effort to come up with words was also as physical as it was mental, and it was so draining, and I would just be so tired.
Yeah.
Yeah.
It's the cognitive effort to recheck, think at the same time with your I guess it is just some form of anxiety. What if there's a big mistake that you can't see?
Mm-hmm.
Yeah. So that must have
Yeah.
been tough. So um in your experience, what do you think employers can do to provide more support or a more supportive environment for people with aphasia? Because like you were saying, your employer, when you returned to work, they understood what you were going through. They understand why you needed the half a day, and um and of course you just mentioned about all the fatigue that you're feeling, traveling, cognitive, and all the stress. Although you can't, no one can see it, but because it's all happening inside. So,
Yeah.
what would you think like what employers can do to provide a more supportive environment?
I think for like speaking to employers, like to create more like a supportive place, you can also just be more understanding that they will probably feel tired a lot more than normal people, normal. I don't like saying that word, but I can't find another word to use right now. But so shorter working hours is good as long as they still get the work done. And after, I just want to kind of like circle back. So then I felt like it was really hard for me to go back to work, and I realized it was too early for me to go back to work. But I was also very excited to go back to work because I wanted to resume my normal life as soon as possible. But then I realized it was hindering my recovery. So then I quit. I resigned. But then earlier this year, they asked me back, and they were the ones who kind of gave me a lot of accommodation. So it's like, okay, we know you're still recovering, but we want you to return. But we're saying like you can do part-time, shorter working hours, and a leaner job scope, and you can also work from home. So I was working from home before everyone was working from home in 2020. So that was, I think that gave me the confidence to be like, okay, I think I'm ready to go back to work because I know I have this support. So if it bolstered my confidence, I think if employers could do that, it will really, really help with them returning back to work. People
It's
with
really
aphasia.
the boost of confidence, right? And at the same time, it's like really they still know that you have the skills that you need to do the job, and they're willing to make changes to job scope to assist you. I think employees out there would need to understand this. That a person with aphasia doesn't mean that they have lost their skills. They still are as intelligent. So that's really good, from your side of your job scope and your employee. So we have a very encouraging message from you, and that's from Hazira. So she said, thank you for being so upfront with sharing about the importance of therapy, including seeing a psychologist to help cope with overwhelming thoughts. So I think that really opened up everyone's mind. It's not a taboo thing to see a psychologist, but we need that help. So really, thank you very much. And just want to share this out with everyone. So remember, just now Shafeeqah did talk about her baking, right? So this is her IG. Look at those cakes, pies. Looks so good. Flying mixer. Check that out. So here you go. There's another picture of her with her baked goods. And really, thank you very much, Shafeeqah, for sharing so genuinely and so honest about what you're going through. I think no one can really imagine what life is with stroke at the age of 26. So really, thank you so much for being so open. And so next week, we are going to have episode 4, which is with our music therapist, how music therapy works, with aphasia. So do tune in at 8:30 on Thursdays. So thank you very much, Shafeeqah, once again. And to those audience out there, thank you very much for your questions, as well as all your motivating words for Shafeeqah, and to many, many people with aphasia, young aphasia as well. So if you want to follow us, we can follow us on Facebook and follow us on Instagram as well. But do remember to tune in to connecting the dots to find out more about aphasia and how other people can help as well. Thank you very much. Shall we call it a night?
Yes, I think.
All right. Good night, everyone.
Good night.